All right, good afternoon, everyone. Thank you for joining us today for the South Texas Regional Family Medicine Grand Rounds. Next slide, please. So here is the CME code for today. I'll leave this up here for a bit so you can all claim your CME credit. All right, next slide, please. This is just information regarding the AAFP credit system. Next slide, please. And these are the core competencies that the Grand Rounds will address. Next slide, please. And here's a brief introduction from Dr. Nato.
Thank you. Dr. Misha Syed completed her undergraduate studies at the University of Texas in Austin in 1997, and then attended Baylor College of Medicine, where she earned an MD degree in 2001. She completed her internship at Brackenridge Hospital, Seton Medical Center, and joined Kresge Eye Institute, Wayne State University, from 2002 to 2005 as a resident in ophthalmology. Dr. Syed pursued training at the University of Texas Houston McGovern Medical School after completion of residency. She became a faculty member at the University of Texas Medical Branch in Galveston in 2006, was promoted to the rank of tenured professor in 2020. While practicing at UTMB, Dr. Syed completed a Master's of Education in the Health Professions from Johns Hopkins University. Dr. Syed has been active as a clinician educator and a glaucoma specialist. She has served as a residency program director. Her leadership roles include being elected to the National AUPO Program Directors Council and co-founder of the Women Professors of Ophthalmology, a national organization devoted to mentoring women in academic ophthalmology. Dr. Syed serves on the Prevent Blindness Texas Board of Directors. She is a past president of the Houston Ophthalmological Society. She now serves as Assistant Dean for Education Affairs, John Seeley School of Medicine, the UTMB. With that, I'll turn it over to Dr. Syed. We look forward to hearing her remarks today about vision impairment. Thank you.
Thanks so much, Dr. Nadeau. It's a pleasure to join you guys. I wish it could be in person, but virtual is the way it is these days. So I'm joining you from Galveston. I hope the weather's better there than it is in Galveston. We're getting buckets of rain. But I guess we need the rain, so I won't complain too much. And I again just want to reiterate my role here today. You heard of my training and background in ophthalmology and specifically in glaucoma. And I was fortunate enough to join the Prevent Blindness Texas board about 6 years ago now, and have served as chair of the board. This is my second year doing that role. And it's really opened my eyes to the other side of medicine being involved in this organization. I hope you'll see today a big part of what I'm going to talk about is what Prevent Blindness Texas can do for you all in your practice as primary care providers. And, you know, a lot of times we see patients in our exam rooms who are having visual issues, and we can identify that, but we often don't know how to get them the services they need, particularly if there are barriers to care. And that's where organizations like Prevent Blindness Texas come into play. So thank you again for taking the time to attend this presentation, and I hope I can impart some useful information to you today. So Prevent Blindness Texas is a nonprofit organization which has been an affiliate chapter of the National Prevent Blindness Organization for decades. I believe the Texas chapter has been active in Texas since the 1950s, if I'm not mistaken. So a long legacy and history of providing visual care to the underserved in Texas. And what we're really talking about today is how do we bridge this gap between your patients who are visually impaired and the services they need. So really, Prevent Blindness Texas is all about creating connections and collaborations to foster healthy vision and improve this access for patients. Today's talk, we're going to try to increase your knowledge to help reduce and mitigate vision loss in your patients, to improve communications between providers within your region and maybe outside your region, geographically and specialty-wise, to optimize patient care and follow-up, and really just increase your knowledge on how you can leverage the services that Prevent Blindness Texas offers and how we can better partner with you. So the history, which I alluded to in that previous slide, we've been around since about 1956. We are the leading public health nonprofit agency dedicated to sight conservation in our state. A mission is, for us, pretty simple: prevent blindness and preserve sight. And in the last 2 years, and this is again, post-COVID, if you think about it, we've been able to serve more than 100,000 individuals across the state through screenings, education, training, service navigation, and even financial resources to improve the access to care and getting treatment. Health equity is a huge part of what we focus on. We want people across the age spectrum, across every stage in life, to experience the highest quality life possible. And a big part of that for many people is vision and eye health. And I know that you all, as family practice providers, that's a huge part of what you do, and your mission is to really improve the quality of life of your patients across the entire life spectrum. So Prevent Blindness Texas has laid out its strategic goals and priorities. Our CEO, Heather Patrick, is very in tune with setting mission and vision. And so we as a board have really worked on this, and our long-term impact goals, besides preserving sight and preventing vision loss, is making sure that eye health is even a part of the conversation when we're talking about patients' health, making sure that eye health is thought about and is addressed across the spectrum of healthcare. We want PBT to be seen as a thought leader, an influencer, a change agent in the eye health space, and we want to advocate for eye and overall health. The way we want to do this is through our priorities, which are awareness, access, and advocacy. And so we really approach our work through those 3 different lenses. For awareness, as I mentioned, we give educational campaigns across the state. We try to compile important data and share out those findings. I'm going to be sharing some data, especially about the San Antonio area, even in visual health today. We really try to connect at any opportunity vision to overall health. Many of the educational programs we do are about how to address systemic health issues through eye screenings. And we need a lot of people to be able to do the screenings that we do. Vision screenings, we train people, we certify them to be vision screeners and to provide this educational information. With access, we're working on collecting data and understanding the barriers that are keeping people from getting into the eye care space, and then basically work on breaking down those barriers, figuring out the delivery framework to get people the services they need. And that includes not only financial, but human resources services to help move clients across the continuum of care, depending on what community they're in. And then advocacy, we really are focused on building an advocacy infrastructure where we're focused on patient and, for children, parent advocacy related health equity and access. And we're working with partners not only in the state, but across federal levels to ensure funding is available to provide vision care and deliver that care. This is kind of a little flow chart diagram of what we do. Again, screening is one of our top programs and services. I mentioned how many people we've been able to screen over the past several years. We have to train our community partners and volunteers to do those screenings. We do the educational component. We have a lot of educational information on our website. I'll be providing that website for you during the presentation, so you guys can check that out. It's a great resource to share with your patients and with other providers. A big part, again, that I mentioned is understanding ourselves. Where are the biggest issues? Where are the biggest barriers to care? How do we intervene meaningfully to help address those barriers and improve the access to care? You're going to hear about this kind of eye care continuum as I talk today. We really want to connect our patients to the best care possible that is available to them in their community. And that requires not only identifying issues with eye care, the patients who need that help, but then working them through the system so that we screen them, we educate, we advocate for them, we navigate. I think that's a really important part of the piece that Prevent Blindness Texas fills for a lot of patients. Helping navigate services for our clients, making sure they know where to go in the community where they can get the care they need. It's not only just identifying the problem, but following up and getting them the care they need, which I think is a problem for our underinsured or uninsured patients across the board. I know that you all do a great job of identifying what are the problems. This patient has uncontrolled hypertension, has uncontrolled diabetes, but how do you get them their medications? How do you get them their follow-up care if they don't have that, that vital piece of assistance like insurance? So we do help provide financial resources where possible for the students, for the children and the adults who qualify. And then we figure out what's working, how many patients are we reaching? We track our data monthly for the people that we have in our system and who are reaching through screening and what's happening further down that continuum of care. I mentioned that we work across the whole spectrum of life, children and adults, but again, we're really focusing on those who do not already have some access to the healthcare system. Low income, uninsured, underinsured. There are people who have health insurance, but maybe not vision coverage. And as you all may know, if you go to try to get a pair of glasses and you don't have insurance coverage, even with a basic pair, it can be $500-$600. And many of the people who live in our communities are not able to afford that. And then there are those who we interact with who may have difficulty navigating the system. It might be a language barrier, cultural barrier, transportation access barrier. So we help identify those issues and try to get those addressed. So we look at our geographically underserved areas because, of course, many of those patients that we're mentioning here live in areas that are underserved. And we help all individuals, regardless of their backgrounds. And if they're high risk, our team works specifically reaching out to them, finding them, navigating with them to get them the resources that they qualify for. Let's focus a little bit on children now. As family practice docs, you guys treat kids as well. And you probably know that school vision screening happens. That's a federal requirement. And it's pretty stark what we find, which is, vision disorders that require further treatment can affect 1 in 17 preschool age kids and 1 in 5 school age children. So you think about that, it's 20% of kids in school are sitting there with a visual impairment. And 80% of what a child learns is through their eyes. So if you are not able to help a child see clearly, that's going to have a lifelong impact. And of course, can affect what happens downstream in society if we have groups of our kids who are not getting this visual care that they need. Here's an example of some vision screenings being done in schools. I don't know if any of you have had a chance to participate or seen them as Prevent Blindness Texas board members. Many of us have gotten certified and do screenings. And I was fortunate enough when my kids were in elementary school, I got to go a few times and do some of the screening myself. And it really is not only very rewarding, but it also is somewhat frightening or disheartening how many kids you identify. And again, that piece of what happens after they're identified, not all screening organizations have a very robust way of following up and making sure that that access to care happens. And that's really a difference with Prevent Blindness Texas. COVID has thrown a wrench in a lot of efforts across the healthcare world, and the vision screening process was similarly affected. We have recovered back to roughly where the number of kids that we're screening. Again, the number that are receiving follow-up care, though, that was pre-COVID and now post-COVID, still hovers around the 50% mark. So if you have a kid who has a vision issue that's identified statewide, only about half of the kids identified are getting that follow-up care that they need. Luckily, our referral rates are maybe going up a little bit, about 10% since the pandemic, meaning they're getting plugged into services after they're identified. The largest barrier remains cost. Families just cannot afford to get kids into their treatment that they need, whether that be glasses or other follow-up eye care visits to the ophthalmologist or optometrist. Many of the parents also said that they can't take the time off work to take their children where they need to go, and transportation itself is an issue in a sizable number. These are the barriers that many people have as adults as well. So it's really affecting people across their whole span of life. A huge number of parents have never received educational information on eye health and safety, over 70%. But more than 50% said that they would like to. And that's another role that PBT can play. We have a great website I mentioned. We are becoming more active in social media. We have electronic flyers and newsletters, but also paper. We do mailings to reach people in that way as well. Because education is a huge piece of the puzzle to make sure that people are getting the care they need. So I want to talk a little bit about San Antonio now, because like I mentioned, we collect a lot of data, and I wanted to share this. This is actually from the US Census Bureau. Your area, San Antonio, has about a 13% prevalence of diabetes. That was in 2021, compared to about 10% in other major cities. The rate of cardiovascular disease deaths per 100,000 was 247.2 compared to 210.4 across other major cities. So there's a relatively high morbidity rate with these common ailments in our country. So I think San Antonio, as much of Texas has, is a really concerning state of health. And about 20% of the population in San Antonio, less than 65, were uninsured in 2022, and that's over double the rate across other major cities. So Texas in general has more of these challenges, and it's even more important that for us that Prevent Blindness is trying to address and help those people in our state, our citizens. I want to mention some of the vision conditions that we focus on with our screening efforts for adults. And you guys probably have seen a lot of patients, your own patients who have one or more of these ailments: age-related macular degeneration, cataracts, diabetic retinopathy, and glaucoma. And these disorders are among the most common affecting adults, and the estimate from the National Eye Institute and research from the National Prevent Blindness Organization is that about of the 130 million or so Americans over the age of 40, about 30 million are suffering from one of these disorders. It's a huge number, and it's expected to double over the next 3 decades or so as our baby boomer population ages and we have an increasing life expectancy. So these are the major reasons why people lose vision and what keeps them from being able to have a high quality of life. So we do screening for adults. We screen over 5,000 adults every year. And the referral rate for adults who fail a screening is about 85% for the clients that we serve. So that's quite a high number of our clients that we're able to plug into services. Besides that direct impact, which is getting and keeping our adult patients in the care system, we also seek to achieve these other results, which are directly educating people on the signs and symptoms of vision issues, eye health problems, getting children more follow-up care when their issues are identified, detecting vision issues earlier, getting people the access that they need in a timely manner for the care they need. Our bigger kind of systemic direct impact goals are to decrease the vision and eye health sequelae from diseases like diabetes, other systemic chronic diseases like hypertension. And that's where a lot of our partnering with primary care providers comes into play. If we can have all of the primary care providers in our state be able to plug in and use Prevent Blindness when they have patients with, for example, diabetes, and maybe they don't have vision insurance, or they haven't been referred to an ophthalmologist with their medical insurance, just plugging them to get in there to their yearly, diabetic retinopathy screening. And that would make a huge difference in helping with these other points that I've listed, which is identifying potential vision loss or risk of loss from these patients who, in the early stages, especially of diabetic retinopathy, glaucoma, other diseases, there are no symptoms. They will not have any idea. It can be very hard to identify, even if you're doing a fundoscopic exam as part of your exam, that can be missed. So plugging them into an eye care provider early is a huge part of this. We're starting to look too at the mental health aspect of vision loss, and how behavioral mental health changes can happen in patients who are suffering from vision loss. And developing eye health advocates. This is another big part of what we do, so that we have people who are trained to go out and make sure that everyone in our communities and our society understands the importance of eye health and is getting people plugged in. Indirectly, what we hope to achieve is through our direct impact, we are able to foster increased literacy, academic achievement, and improved development, specifically for children. We also aim to collect data that's going to help shape policies surrounding eye health, funding for eye health research, vision loss prevention programs, not only at the local and state, but the federal level. And Prevent Blindness Texas is very active in applying for grants and trying to get the funding so that we can improve this data collection and research. And then, of course, overall eye health and safety would be a positive indirect impact of our efforts. We partner with a lot of different entities and systems. Of course, the school districts, we're active across the state with many of the very large school districts and smaller ones, but there's a few listed here, as well as charter schools, daycares, to identify those preschool age children who might have vision problems. The state of Texas, community resource centers, federally qualified health centers, so FQHCs are also our partners. Some of the optometry schools and medical centers, University of Texas Medical Branch is a big partner with PBT. And then the local clubs, Lions clubs in particular, they have a strong vision mission, and we've partnered with them quite a bit. So let's talk about how we can work together. And I know I've mentioned that as I've been talking today. Where can we bridge this divide between providers of health and providers of eye care? Specifically with children's vision, our questions are, how can we help ensure that children get the eye care they need, and that there's this communication or connection to their primary provider, their pediatrician. We want to make sure that families have medical homes. And I know it's not a new concept in medicine to have the medical home model, but we want to ensure that eye health is a part of that medical home. In our state, children's vision screenings are mandated every other grade, so in the odd grades through 7th grade. But as I mentioned, approximately 50% of the children who are getting these screenings still do not get follow-up care. What happens is if a child fails the screening, then the parents or the caregivers are notified and the child's referred for follow-up care. We already talked about the barriers for referral. Even if a family knows that a child is identified, they may have issues with cost, time off work, transportation to get that child the follow-up care they need. So organizations like PBT, we actually can intervene in those situations. If we're plugged in, we can help when those barriers are there to help the child get the resources they need to address the vision issue that's been identified. I have some questions here. What has your experience, the people who are attending this talk today, what has your experience been with children specifically and vision care, and what gaps do you see, and maybe some ideas on how do we work together to close the gaps? I'd love to pause here for a second and see if anyone in the room has comments or maybe anecdotes or questions.
I have a question. Can you hear me?
Yes, thank you.
Hi, I'm with the Center for Healthcare Services in Bear County. We predominantly cover patients that are unfunded or BCA. And a lot of times we'll use the Haven for Hope Eye Care Center if possible. But if we were going to access Prevent Blindness, where are those clinics? And how do we go about referring?
Yes, that's a great question. So we have a very dedicated staff as part of Prevent Blindness, and they go out to all the different regions in the state. And we actually have people who are specifically for the San Antonio area, and then of course for our other big areas, Dallas, Houston, West Texas. So we have partnerships with many of the local agencies already. So we can often work directly with them and sometimes provide vouchers, for example, for follow-up care at clinics and or vouchers for glasses, et cetera. I will be providing some information about how to get in touch with our office, and that probably is the best way to see. We may already have a partnership with, I think you said Haven for Hope, but we don't necessarily need to reinvent the wheel. If you already have a system that you're getting this care for your patients who are identified for the clients, but we can maybe provide that extra, when needed, extra financial resource or extra connection to maybe different agencies in the area that we know can also provide care. So we're almost like an intermediary, or going back to that idea of being an advocate, helping you guys in the communities to make sure you're linking in with all the resources that might be available.
Thank you.
Thank you.
Dr. Syed, one of the residents here in person had a comment. So she was wondering where kids can get affordable vision screening when she's noticed that certain insurances don't include routine vision screening.
Right. So let me make sure I understand the question. So it's when the school screenings, regardless of whether school screenings are happening, how to get other children the pediatric or the vision care they need if they don't have vision insurance. Is that what
Yes, that's correct.
Okay. So even with without vision insurance, the pediatrician also, if they're getting regular medical care with a pediatrician or with a family practice physician, the vision screenings can be done through, or should be done through, their visits with that primary care provider. And then that if an issue is identified, then that pediatrician or that physician can be plugging them into local resources. Does
Okay,
that
thank you.
answer? Okay, you're welcome. Any other thoughts or questions? Okay. And please feel free to stop me anytime here if you need to ask anything. I'm sorry I can't see people the screen. So moving now to adult vision issues as well, you know, as I mentioned, we're really focused on trying to identify those patients with systemic conditions that have potential ocular disease findings and vision loss from those findings. It's really important to have the comprehensive eye exams. And the question that was just brought up by one of the residents is how, you know, even if someone has a risk factor or has been identified, they may not have the specific vision insurance, even if they have medical insurance. But even that medical insurance should allow you to get plugged in within the medical system to get that further eye care. So for example, the ocular complications from systemic conditions of vasculopathic conditions like diabetes and hypertension, those are big ones that can have vision-threatening complications. Very common is dry eye, and I'm sure you guys have had patients complaining of dry eyes in your practices. They can be due to things that are more benign or more serious, but generally to really identify the issue, the etiology of the dry eye, they should be getting a ophthalmic referral to rule out some more, you know, dangerous or consequential findings that are associated with dry eye. Systemic medications can often have ocular side effects. So that's another area where there needs to be kind of a education and understanding of which are the medications to watch out for that can cause eye issues. Of course, trauma, you know, urgent and emergent conditions, these are really important to get ophthalmic care for. And, you know, there may be other eye issues that you guys come across in your practices. And it would be interesting to hear how often, if you're seeing these kind of issues that I mentioned or other visual issues, and what are the gaps there with getting patients the care they need that you all have seen or identified? Or really, are the eyes even talked about? Sometimes, you know, you guys, it's hard. You have maybe 10 or 15 minutes to do a whole yearly well check, or, you know, it's not a lot of time. So does anything come up with the eyes or vision when you're seeing your patients?
We talk about the eyes a lot. I mean, because we talk about diabetes a lot, right? So
Right.
that's a matter of trying to get people screened every year. One question I have is, one of the strategies that the system uses is some of the screening is photo eye. And how do you think that compares to sending them to ophthalmologists or optometrists to check that?
Yeah, great question. That's a wonderful point. We use technology to our advantage whenever possible. And so if your healthcare system is plugged in with kind of a telehealth or telescreening program, then absolutely, you know, it's a pretty successful identification rate, a sensitivity of the images, provided they're of appropriate quality. And most of the time, if you're doing a formal system like this, then you get images that are appropriate. And that can be a great way of screening where the patient does not have to come into the eye clinic and get the in-person exam. And then, of course, if anything is identified on the photos, then that person gets brought in. So if you're already using that system in place, then that's great. That's a head start. We know that patient outcomes are significantly improved when the PCP is able to either remind patients or refer patients for a yearly dilated eye exam and or, you know, photo screening, where there is this next step taken for that screening process to happen.
So at least I think I have trouble with, if you got patients that don't have diabetes, right? But they need just they like have refraction error, right? Like a lot of people have, and even a lot of people with good insurance don't have, have coverage for that. But it seems to be more of a problem for patients without diabetes. I've kind of wondered over the years if sometimes when they go for their ophthalmology exam, they get refracted and then they got a prescription. And so, but if you don't have that, then you get, do you have any suggestions for how to help in a fairly low cost way in that setting? And is my impression correct that sometimes they get a refraction when they go for their yearly exam?
Yes. Okay, so I can answer that last part first. When you go for a medical eye exam, if the patient's referred and, however they get there, there's a full medical eye exam done, but frequently there is a refractive error component, and we address that as part of the exam. Now, the tricky part is that at least where I work, we cannot bill under the medical for the vision component. It's not covered. So then we're stuck with either if the patient doesn't have separate vision insurance that our system takes, then we can give them the prescription if they pay a separate cost to take that prescription with them. And then there's the cost of getting the glasses made, which, as we already mentioned, can be several $100s. So that is a challenge. And Prevent Blindness is actually a resource here as well, because what we can do often is within a community, we may have a partnership with some local optometrists or primary care eye clinics that they can get a reduced cost for glasses, for example. Those are partnerships that we build community by community. So even just reaching out to Prevent Blindness and saying, hey, I have this patient here, doesn't have vision coverage, won't be able to pay for these glasses. And often you can find a less expensive solution. It may not be no cost, but at least reduced cost for that person. That's a great question. Any other questions?
That's helpful. I think some people get the prescription through some sort of discount or something, or just something very generously done by the clinics. But that seems to be more trouble to me for patients that don't have diabetes, because they start with nothing and they've got to pay for both the refraction for the glasses.
Exactly. So that's where our adult vision screenings can come in handy too. And that also can be, kind of coordinated through Prevent Blindness. If you reach out and let's say you've got a patient in San Antonio needs glasses, we may have a screening event from where if that person got screened and yes, identified with an issue for vision, we can give vouchers many times. Like I said, we have partnerships and collaborations with different agencies and companies, and that voucher can be then taken for a reduced cost pair of glasses.
One more question. This is about like kids with amblyopia. I've seen a couple who the findings were kind of subtle, right? So they don't get found early, right? So then they get to be 6 or 7 or something, and when some of the benefit may have been not achievable at this point, and also at that age they're culturally not as willing to wear the patch. A little more resistance there. So, you have any tips on that? I've seen a couple found just by they're 6 or 7, and somebody figures out, I don't think they can see that good out of one eye.
Yep. Yeah, it's a huge problem. And like you said, it's a time-sensitive issue, identifying amblyopia in these school-age kids. And 7 or 8 is about your window, after which, these interventions like patching and correction of refractive error may or may not really have a benefit. Usually not as much. So as far as once they're identified in your office, if you say, oh, I think this kid has amblyopia, I'm going to sound like a broken record, but Prevent Blindness, if they don't have, if you cannot make a referral with their medical insurance, which you should be able to refer them to a pediatric ophthalmologist or at least a general ophthalmologist who can then plug them in further for pediatric specialized care. Prevent Blindness also has resources for children as well who are identified with those issues. And we have area practices that are often willing to see those patients as well. So it's helpful, I think, to know that if you reach out to Prevent Blindness, there is almost always some connection, some community partner that we can find to help when you have those situations. And once that partnership's made, then between Prevent Blindness and your practice, it becomes easier to have that that as your go-to when you identify people who have these needs. It solidifies that. And it helps us, quite frankly, because then we know, where patients are coming from. We can actually do more screening in those communities if we see there's a number of patients that are being referred to us through family practice or internal medicine practices. Then we know, okay, geographically, we need to focus more of our efforts here. Great. I don't know if there's any more questions on this before I move on.
I do have a question. For places like that there are cheap glasses options like Eye Clinic or like America's Best Glasses or like even Walmart or Costco, but they don't really have good follow-up. Do you recommend, like, if people do have maybe like $200 to spend on glasses, do you recommend us telling them about places like that, or use for actual ophthalmologist offices?
Right. So you're saying beyond just getting the pair of glasses, how do you make sure that they have kind of an eye care service as far as examining the eyes? Is that,
Yeah, exactly.
Yeah. Okay. Yeah, no, it is a great question. So I'll give an example in Galveston, in our community. Prevent Blindness has a very strong partnership with our, we have a clinic called St. Vincent's Community Clinic, and it's a multi-specialty clinic. We actually have an eye clinic within it, but we have an ability to, so if Prevent Blindness gets in touch with someone in Galveston, get either through a vision screening or they get referred from a doctor or someone that needs an eye screening, we can actually, Prevent Blindness can actually connect them with St. Vincent's, whose mission is to take care of people who are under or uninsured, otherwise lacking access to care. And most communities, and I'm almost positive that San Antonio has something similar where there are these eye care kind of free or reduced cost eye care clinics, and those are big partners for us. But again, if you go through Prevent Blindness and ask about that, then we're usually able to connect those patients with those services.
Thank you.
Thank you. So I'll just chat a little bit more here about, and we've started to touch on this already, what would be helpful to you all from an organization like Prevent Blindness to help your patients understand better about eye disease and the connection between systemic health and eye health. We know that you guys have a very constrained schedule, and you're having to see a good number of patients every day. So how can we help kind of streamline this communication between you and your patients, but also kind of how can PBT become kind of that that cog in the wheel where we can help streamline communication maybe between you and the local eye care clinic that might be able to see your patients, and or your patients directly, and connecting them with providers. And like I said, we've already kind of started talking about this, but I would love to hear ideas, because we're unique. PBT is unique in that we provide services kind of along the continuum. It's not just one aspect of care. We don't just do vision screenings and stop there. We're really trying to help patients with their eye health across all the multiple different steps that it takes to get from identification of the problem to taking care of the problem. We can assess gaps within a community, but if it's that much easier for us to be streamlined and effective in what we're giving to a community if we know what gaps are there. And you guys referring to us helps us identify, like I mentioned, where the gaps really are, and then we can focus our efforts. So it's kind of like a circular relationship, in that the more you contact us, the more we can actually help, not only in that moment, but help for future care in that community, because we'll be able to identify where's the where's the services in that community, where are the gaps in that community, and how do we fix it? Any thoughts on what might be helpful for you guys in the day-to-day from us?
The access is the issue, right? We got a large number of patients, and what you want is every time you refer one, they get what you think they ought to get, sort of thing. So I think that across the medical enterprise type of a problem, but that's what we need. Somebody's got diabetes or whatever they got, we want them to get seen, and they get seen. That's what we need.
Right. So when you have this issue where it's not easy enough to plug someone in, you see a diabetic, you say, okay, they need to get screened. And for some reason, there's not an ability for you to send them to an ophthalmologist or an optometrist within your system for whatever reason. That's where maybe we need to be plugged in, where you can look on our website, send a quick message, or call us directly and say, this is the issue I have. Does that sound like kind of what you're looking for?
Well, I think that helps address part of the problem.
Yeah.
Yeah.
Yeah, for sure. And as you do that, we're educating whoever is calling us, right? Because we can say, oh, in San Antonio, this X clinic has free eye care screenings every month at, whatever location, whatever time. And then you then have that information for the next patient that walks in that may need it. You can already impart that. It's organic, and it's kind of it's hard to know. Again, I go back to the circular analogy. It's hard for us to know where the gaps are unless we're hearing from you. And then as we hear from you, we can address, and then you all are also more educated to say, oh, okay, I know this is in this neighborhood, there's this, resource that the patient can use. There's also ways that you can get directly involved if you have an interest in Prevent Blindness Texas. As I mentioned, many people on our board, and we have volunteers who become certified Prevent Blindness vision screeners. And you guys can actually go out into the community, be a part of the screenings that happen within schools, but also the screenings we do outside of schools at different health fairs and other entities. Like I mentioned, for Galveston, we have the St. Vincent's Clinic. We actually have vision screenings that are held, I believe, monthly in the clinic facility, but they're open to, everyone in the community. You can become a referral partner agency. So this might be something that makes sense for you guys being, within a healthcare system. You can actually become a formal partner, and you can help with the process of getting patients referred to where they need to go. Attending our special events is actually a great way to support PBT's cause, and then also just be involved. And we have very kind of different and fun events throughout the state. We do an event in Houston called Dark Dining, where it's kind of a sensory experience, and you kind of lose your vision for one part of the night, and you have silent auction, and there's music. We do a golf fundraiser in the Dallas area. We've had events in the San Antonio area previously. We're trying to build those back up in your specific area, but at any rate, our website has all of this information, and it's like I said, a great way to get involved. We have committees within our board. You don't have to be a board member, but you can be a committee member in different areas. We have a marketing and development committee. We have a public health committee. A lot of our more medical minded people are on the public health committee, for example. All of this is, again, explained on our website. So if you're interested, that's a great way to get involved. And that really educates you as a healthcare provider. If you're on a committee, you're going to fully understand kind of the scope of Prevent Blindness services and the possibilities of helping your patients. So it's a nice way to learn more about what are the resources available to you and your patients. We even offer internships. So we have students, a lot of optometry students, pre-medical students, even college age students can be involved So if you have people in your family, in your community who might be interested, that's a great way to kind of pique your interest as a younger person. One of our board members, Dr. Garza, she's an optometrist in Houston. She actually learned about Prevent Blindness Texas as I want to say she was a college student or an optometry student, I can't remember, but she got plugged in and now she's been a board member with us for years. So it can be a nice way to even be for a budding healthcare provider to get involved. We do have a sign up for our emails. That's another way to get information about what's going on with PBT, what services we're offering. Social media, same thing. And so we really just would love to have more continuum of care partners. That's what we're all about, is building these ties. As we all know, healthcare can be complicated. It is by its nature somewhat disjointed in the way that we have it in our society, but it doesn't mean that we can't get our patients the best care possible. And the way to do that is to be aware of these services, to plug in to the system and the resources through Prevent Blindness and help get your patients and your community tied in. So here's some information about our social media platforms. These are, like I said, great ways to follow us. We have a very dedicated staff who keeps up with all this. I myself am not a big social media person, but I know that they always are sending stuff out and really connecting across the state through these platforms. And then there's, of course, our information about how to contact us. Please keep this website handy, preventblindnesstexas.org. That's your #1 resource if you're looking when you're seeing patients and you think you need to get some assistance for them for vision health. Please start there, and we have a very well laid out homepage that can help you get connected where you need to be and get in touch with people who can help you. I mentioned Heather Patrick. She's our president and CEO. Very dynamic and visionary. She's a great person to contact if you are interested in getting more involved or getting involved with events that are happening. Please plug in with her. And Monica Guerrero, she is a fireball. She helps plan all of the screening. She goes all over the state to help get these community programs up and running. So just wanted to share that because they're really important point people. But we have a lot of folks working behind the scenes. So if you reach out to us, please, don't hesitate. If you have questions about a patient that comes in, just make sure that you contact us and we can do the legwork to help you get the services that you need. I'd love to take any more questions if people have any or comments.
We really appreciate you spending some time with us and teaching us.
Oh, it's my pleasure. It's been really fun. Like I said, this has been a labor of love. It's not my job, definitely, but it's a lot of fun to do on the side, and I completely understand as a medical provider, it's sometimes a frustration of not being able to do something about a problem once we identify it. And this is one way to help your patients who may be having vision issues. Please just contact us and we will do our best to help you. All right. Wonderful. Well, I can hang out for a minute or two if anyone else has questions, but I greatly appreciate your time. And I hope that we get to visit with you at a Prevent Blindness event.
Thank you. It was great.
Thank you.